Yeah, hi, my name's Tracie Tan. I'm a neurologist working at the Alfred Hospital with subspecialty interests in epilepsy and neuroimmunology. I'm also a postdoctoral fellow at the Monash University down in Melbourne, where I do research in epilepsy as well as its associations with neuroinflammation and autoimmunity. So epilepsy is a relatively common brain disorder, I think estimated to affect over 150,000 Australians. And it's basically a disorder where patients are predisposed to recurrent seizures over time and therefore need medications to help control their seizures. Seizures themselves are basically where you've got electrical dysfunction in the brain causing relatively unpredictable episodes of neurological dysfunction and can manifest as collapses, loss of consciousness, confusion, motor activity that's uncontrollable by the patients. And because it's so unpredictable, it can result in significant injuries to the patients when they occur, as well as, a lot of patients will complain about memory changes, confusion, and it does have social impacts as well in terms of restricting driving, for instance, if they're having ongoing seizures. We've talked a bit about epilepsy, but and trying to control the seizures with medications, but unfortunately, still about 30% of patients with epilepsy will be what we call drug resistant. In other words, despite having more than 2 anti-seizure medications at appropriate doses, they're still having ongoing seizures. These patients are, in fact, at as you can imagine, increased risk of injuries to themselves and have a lot more side effects from the multiple medications they're on, and a lot more cognitive impairment, and obviously the driving restrictions that we've mentioned before. And so despite, so it's still quite a high percentage, and despite the advent of or development of 12 or more anti-seizure medications on the market in the last 30 years, the rates of drug resistance unfortunately hasn't really altered at all, or that much. And so that's probably because the new medications that are on the market work mainly via decreasing neuronal transmission or dampening down neuronal activity. And so what we really need to find is novel mechanisms for drugs to work on to help improve the outcomes for these patients. And so I guess the premise of our study is there's been previous sort of animal studies and some human studies that have implicated neuroinflammation or inflammation in and around the brain as a driver for epilepsy. And so we really wanted to explore that a bit further with a technique that has not yet been used in investigating this population. So it's a type of proteomic study that we're planning to do, which has a high sensitivity, high specificity, and also is quite reproducible, and can help us look at thousands of proteins in biological fluids. And so we're hoping that by doing this sort of really large screening, in particular of the cerebral spinal fluid in patients with epilepsy, so that's the fluid that surrounds the brain and spinal cord, that we will be able to discover novel proteins that might in future be amenable to therapeutic targets that might help improve the rates of drug resistance in our patients. This study is very much a first step. It's a very exploratory study where we're getting patients with epilepsy and comparing them with people without epilepsy and trying to discover these novel biomarkers. And hopefully if we do find something, it's really going to lead to a lot of future research where we can take those markers that we've identified and see if there's therapeutic or treatments that we can target to these patients, and then do trials in patients. And I guess the long-term impact that we hope to have, that we really hope will come out of this research, would be novel treatments that do help reduce the rates of drug resistance and help patients, have the seizures under control, which will be, have a huge impact not only on patients themselves, improving their quality of life, allowing them to get back to driving, but also, wider social implications as well. Epilepsy itself is thought to cost the Australian economy, for instance, $12.3 billion a year. So, there's a lot of wider ranging impacts on the Australian society in general as well. So I guess, that's why we really wanted to look into improving the treatments for epilepsy. One, improve the lives of patients with epilepsy, and there's a lot of people out there who suffer from this disease. but to also broad implications and impacts in terms of flow-on effects to their carers and also to the Australian society in general.